Phone use policy reminder. Staff should not use personal phones at the nursing station, in hallways, or inside patient rooms. Why? Using phones during work hours can appear unprofessional, distract from patient care, and violate privacy and HIPAA regulations. It may also give residents, families, and surveyors the impression that staff are not attentive to their duties. Impact on the facility. Increases the risk of missing resident needs or emergencies. Damages the facility's professional image and reputation. May lead to citations during state surveys for unprofessional conduct or privacy violations. Expectation. Phones should only be used during designated break times and in appropriate staff areas. Our priority is always resident safety, privacy, and quality care. No eating at the nursing station. Staff should not eat at the nursing station. Why? Eating at the nursing station is unprofessional and poses an infection control risk. The nursing station is a clinical area used for handling medications, documentation, and resident care information, not for food or drinks. Impact on the facility. Increases risk of contamination and infection spread. Creates an unprofessional appearance in front of residents, families, and surveyors. May result in citations during state inspections for violating health and safety standards. Expectation. Food and drinks should only be consumed in designated break rooms or staff dining areas. Maintaining a clean and professional work environment shows respect for residents and supports our infection control efforts. No sleeping in patient rooms or at the nursing station. Staff must not sleep in patient rooms or at the nursing station during work hours. Reason. Sleeping while on duty is unprofessional and unsafe. It gives the impression that staff are neglecting residents and can lead to serious consequences if a resident emergency occurs. Impact on the facility. Puts resident safety at risk due to delayed response. Damages the facility's reputation and public trust. Can result in disciplinary action or citations during state inspections. Expectation. All staff are expected to remain alert, attentive, and available to residents at all times while on duty. Rest breaks should be taken only in designated break areas and only during scheduled break times. No gossiping in patient rooms or care areas. Staff should not gossip or discuss personal matters in patient rooms or any care areas. Why? Talking about other staff or personal issues in patient areas violates resident privacy and creates an unprofessional and uncomfortable environment. Residents and families can overhear conversations, which may lead to breaches of confidentiality and loss of trust. Impact on the facility. Violates HIPAA and privacy standards. Damages the facility's professional image. Can lead to complaints or citations during inspections. Expectation. All conversations in patient care areas should remain professional and resident-focused. Personal or gossip-related discussions should only occur in designated break areas and never in front of residents or visitors. Always stay professional. All staff are expected to maintain a professional appearance and attitude while on duty. This includes dress, shoes, facial expressions, and general appearance. Why? Professionalism reflects the quality of care we provide. The way we present ourselves communicates respect, competence, and pride in our work. Residents, families, and visitors form their first impressions based on how we look and act. Impact on the facility. Builds trust and confidence among residents and families. Strengthens the facility's reputation. Prevents complaints or negative feedback during inspections. Expectation. Wear clean uniforms, closed-toe shoes, and maintain good hygiene. Keep facial expressions calm and respectful, even in stressful situations. Always represent yourself and the facility with dignity, professionalism, and pride. Do not hide or sit in patient rooms. Staff should not hide, sit, or spend unnecessary time in patient rooms when not providing direct care or performing assigned duties. Why? Sitting or hiding in patient rooms without purpose can appear unprofessional and may give the impression that staff are avoiding work or neglecting other residents' needs. It also raises privacy and safety concerns for residents. Impact on the facility. Reduces staff visibility and availability on the unit. Can lead to missed resident needs or delayed responses. Creates a negative image to families, visitors, and surveyors. Expectation. Staff should stay visible and available on the unit, assisting residents or completing assigned tasks. Patient rooms should only be entered for care-related activities or when responding to a resident's need. Prohibited no ADLs or other activities when food trays are on the floor. Staff must never perform ADLs or any other tasks when food trays are on the floor. Why? This is both unsanitary and disrespectful to our residents. Food placed on the floor can easily become contaminated, putting residents at risk for infection, illness, and loss of appetite. It also gives a poor impression to families, visitors, and state surveyors. Resident care impact. When staff delay serving meals or allow trays to sit on the floor, residents may receive cold food, which affects nutrition, comfort, and satisfaction. Every resident deserves to eat their meal fresh, hot, and on time. Expectations. Never place trays on the bed unless a patient asks you. Use clean overbed tables or meal carts only. Prioritize meal service over routine ADLs when trays arrive. Complete care after the resident has eaten, unless there's an emergency. Ensure residents are positioned safely with bibs and ready to eat as soon as trays are delivered. Why it matters. Following this rule supports infection control, resident dignity, and quality of care. It also helps prevent survey citations and shows our commitment to professionalism and respect. Glowing Star. A note of appreciation to all staff. Glowing Star. I would like to take a moment to sincerely thank each of you for your hard work, dedication, and compassion. Your teamwork, patience, and commitment to our residents make a true difference every single day. Whether you are providing direct care, keeping the environment clean and safe, or supporting behind the scenes, you are the heart of this facility. Please know that your efforts are deeply appreciated. Thank you for continuing to show professionalism, kindness, and respect in all that you do. Together, we make this facility a place our residents can proudly call home. Thank you for all that you do. You are valued and appreciated. Blue Heart.